So we're going to get our supplies that we need. We're going to get some alcohol swabs here, and we are going to get some gauze. And we've got our 1% lidocaine with epinephrine already, and so we're going to come over and work on getting this spot numbed. So first we're just going to clean this spot off here. And so when we do that, we're going to just go all around this area with our alcohol swab.
I betcha.
And when we go to numb up this spot, we're going to first start at one edge so that way it doesn't feel quite so pinchy. And as we do this, we're going to slowly move around in a circle to cover this entire area. And we are doing just subcutaneous injections here, so there are not any major nerves that we need to worry about because we will not be going down deeper than the skin. But when we do this, I find it helpful to always have a gauze with you so that way if some of the lidocaine does drip down, it doesn't feel like there's a liquid running down your arm. Otherwise, sometimes people worry that there could be bleeding that is causing that running.
Oh, perfect.
And I like to squeeze the skin a little bit. It makes the pinch sensation feel a little bit less, but you never want your fingers to be in front of the needles. And so I'm going to just pinch your skin, but keep my fingers behind the needle, and then we will work on just numbing this. And with that lidocaine with epinephrine, if you inject it very quickly, it tends to cause much more of a burning sensation in the skin. And we want to make this as pain-free as possible. And so we're just going to very gradually inject that lidocaine with epinephrine.
Perfect.
And you can start to see the skin puff up in the areas where we've got that lidocaine with epinephrine. And you want to move around through that same opening that you have in the skin. Move the needles in different directions so that way you can cover this entire area with that numbing. And now, once we've covered this complete area where that needle could reach, now we want to go back through an area where it's already numb. You can see where the skin has some paler right here from where the numbing is. And so we're going to go through an area where it's already numbed up so that there's not that initial pinch sensation again. And then work on numbing this next area.
Excellent.
Are you doing okay? Not too much discomfort?
No, I can't feel anything.
Good.
That's great.
Good, good. Then we'll do that same thing. We're going to keep working our way around here. Perfect. Okay. And then we're going to stop and get our next tube there. Just clean that off again. You can already start to see the skin becoming numb in the places that we've already injected. And we'll continue to go through places where the skin is already numb so that we don't have more of that pinch sensation. Good. And go through this last side here. So with the lidocaine with epinephrine, it's really primarily designed to block the nerves that carry a pain sensation. It doesn't completely block the nerves that carry a pressure or a cold sensation. And so when we go to remove the spot, you will still feel pressure on the skin, like someone is touching the skin, but nothing should feel pinchy or pokey. If at any point in time you do feel anything that feels sharp or painful, please let us know and we would just stop and put more numbing medicine there.
Sure, okay.
Yes, but otherwise you can see we've really gotten that lidocaine with epinephrine to go around that whole area, and so we can feel fairly confident before we even start that we really have this completely numb in that whole area there.
Excellent, yeah.
Okay. Okay. And then Andy, we've cleaned this off with alcohol just while we were numbing it, but we need to also clean it with Hibiclens to sterilize that area. Sure. And so we're going to be laying down a sterile drape right now. And what we will do is after we lay down the sterile drape, everything that's in the opening there, we want to make sure has been sterilized through this opening. So we're going to lay this down right here, and then we don't want you, if you need to reach and move around, you certainly can, but just please don't reach up and touch on top of the sterile drape.
Okay.
And then this might still feel a little cool with the Hibiclens, because remember, the numbing medicine is really primarily designed to block the nerves that carry that pain sensation. You can still feel pressure oftentimes, and you'll usually still feel chilliness with that surgical soap as well. And it doesn't mean that that skin isn't numb, it's just that it's blocking the other nerves that carry pain, but not necessarily the other types of receptors.
Sure.
And so when we wind around that area, we always start in the middle and then work our way out in a circle with the Hibiclens, and we do that 3 times to make sure that that area is fully sterilized. If we had only been cleaning with alcohol you have to let wait until it completely dries to have that antiseptic effect. Hibiclens fortunately works whether it's wet or dry. So we are ready to begin.